The biggest change that I have is I know for sure, number one, I'm not diabetic anymore. I don't have to rely on medication. And I don't have to always worry I'll be on hypo kind of thing. Because you restrict your movement, you restrict a lot of your quality of life. So right now, I'm pretty confident that I am healthier than the rest.
Hello, Stephen. Thank you for joining us.
Thank you for having me.
Okay, let's just talk a little bit about your diabetes. When were you first diagnosed?
Actually, it was roughly 6 years ago. I think roughly there because I can't remember the exact date. So I realized is every time when I fully stress out, the reading will go extremely high. So I thought that it may be due to my stress. But later I found out that, well, it's always been high.
And then when you got tested, what medications were you put on?
I think earlier was Genumet 5500.
I see.
So it's roughly along the line 5500.
I see.
But I noticed that the reading is still above the benchmark, so above 6. So it gets me, thinking, is this meds right for me or not?
And later on, you mentioned that you moved on to higher doses and different types of medications. And you shared with me a complication that landed you in the hospital. Would you like to talk a little bit about that?
Okay. Actually, what happened is the doctor prescribed Jardiance together with Genumet. So they say it's the best combination ever. But somehow, because I was traveling, I was in Bangkok, and somehow, I don't know what happened. Maybe I'm too tired or there are too many things. I couldn't pass urine. And I was in Bangkok. And that really gave me the jittery. So when I come back to Malaysia, I quickly check myself into SJMC. They say that there's urinary tract infection. So I was wondering what causes the infection. Then my theory was, I think it may be due to the Jardiance. Maybe due to Jardiance, I'm not very sure.
Okay.
Yeah.
And did the doctor explain to you that how Jardiance worked and how did it extracted your sugar through your urinary system and release it?
They did. Usually doctors would talk with their own medical jargon. We are lay people, and when you talk with all those medical jargon, we'll just shake our head pretending that we know, but actually we don't know what you're talking about. Yeah, so that's the way about it. Yeah.
So would that be accurate to say that was your turning point to start something different and think of an alternative to control your diabetes?
Actually, it's one of the turning point. And also, what happened is I realized that, my family, mostly are non-diabetic. We are non-diabetic. And it just it catch me thinking, it may be my diet, it may be something. And so I met you in the Certified Professional Trainer course. And you put yourself as the expert in diabetes management. That really caught my attention. So that's why I just come and see you and to see what do you have to say on that.
So how many months has it been that you are totally off your medications now?
8 months already, since December. Since December 2019, I've been off meds, no more meds.
Okay, and tell us, what are your HbA1 readings now after going off your medications?
My HbA1c is around 4.5 to 5.
Wow.
And usually I do my test every 3 months, diligently, because I myself want to know. And it's because that I'm also an engineer, and the engineer curiosity wants us to test all the time.
So how fast into the program were you able to get off your medication?
Okay. Through my discussion with you, I realized that Genumet 5500 doesn't work on me. Then I realized that each body is different. And I also realized that most medical doctors don't actually test the meds to be used on you. They just give you a med and you just follow. But they didn't test whether it's workable, it's effective or not. They don't do it. Only you have tested me on a lot of drugs. and I found out that Dimecron works for me, but it's only through you that I know about all this.
Okay. So
Yeah.
what was the control in the sense of how did we go about the testing? Was it the 2 hours after your eating results, like postprandial, did you discover that you were finding out what is useful to you and what's not?
Oh yes, actually for all the 3 meals, breakfast, lunch, dinner, we have to poke our fingers before and after. And because of your guidance on how to take the meds, I'm able to know that Dimecron works well with me, and it won't create hypo kind of thing in me as well. So I find that it works well.
Okay.
Yeah.
And how soon were you able to get off your medications totally?
I think it's roughly around 3 months or so. But to qualify, we still need to have a very strict diet.
Yes.
Yeah.
That's the absolute emphasis here.
Yeah.
The consistency, would you attribute your success to having a consistent diet and somebody who checks in and out regularly?
Oh yes, absolutely. Because we meet up every Saturday, right? And you ask me for the readings. You always put me into a check and balance position that I don't simply eat. Yeah.
How important is it that you have the data with you?
Very important. Like what I say, I'm an engineer, and data means everything to us. We need to know before, after, what happened if I eat this food, and what happened if I eat the other food. So I need to know all the details, and it helps us a lot and give us confidence. When anywhere we go, we know how to improvise. We know what to take, what not to take, and what is bad for your health and what not.
All right. I would like to ask you your perception on diabetes education. How was it like before and how is it like now? Do you feel that you are better equipped and you know a lot more about your disease?
Yes, definitely. But I would still advocate that whoever go on this diet go through a qualified medical doctor like you, because then you can put us on a right type of program. Because we are laymen, we cannot ask people to go on diet when we are not qualified to say so. So we will still advise those who wants to embark on this to go through you, so you can monitor them and you can teach them step by step on what to do.
I see. And what is the biggest change you've seen in yourself?
The biggest change that I have is I know for sure, number one, I'm not diabetic anymore. I don't have to rely on medication. And I don't have to always worry that I'll be on hypo kind of thing. Because you restrict your movement, you restrict a lot of your quality of life. So right now, I'm pretty confident that I am, I'm healthier than the rest.
Wow, that's good.
Yeah.
And let's dive into a little bit about sensitivity. You told me that you're realizing that your blood sugar levels are much more stable right now, even though you indulge in a few carbs every now and again. Tell us a little bit about that.
Okay, I love durian, and especially 2 months back, it was the durian season. And what happened is I decided to take a test. Before that, I was very strict with my diet. And I realized that because of the low carb or no carbs diet I've been on for the past so many months, it makes my body very sensitive and able to process whatever sugar in my body. So what happened is I did eat a lot of durian. I tested my blood before and after. And it's amazing. I mean, after 2 to 3 hours, my blood sugar went down to 5.9. Beginning, I was skeptical. I was really skeptical because usually all my GP and the rest of the doctors say, eat whatever you want. You are the only doctor who say, no, control your diet. So we have to go past the mindset. Once we go past the mindset and through your guidance, I think it's not hard at all. Beginning, yes, the first month will be hard because it's more of the hunger pang. You feel you have to eat carbo, you have to eat carbo, you have to eat carbo. That's the only difficult thing. Other than that, no.
I see. So, given your new found status as having reversed diabetes, do you have any message for anyone who's newly diagnosed or are in the middle of their diabetes
Okay.
treatment? Do you have any message or something to say for them?
Yes, actually, my journey shows me that diabetes is actually a dietary disease and it's not a death sentence for you. You don't have to feel that it's the end of the world, but it's only the beginning of a journey. Being Asian, you love carbs. So this is the time that you cut on your carb, maybe to none or little carb. And to all those people, you can do it, but please do it under guidance. What I would advocate for you to do is, please, before you embark on this journey, go under a medical supervisor, somebody with medical background to supervise on you. And I believe that you can do it.